Welcome, and thank you all for being here. This is a very interesting group of individuals, and I'm delighted that you decided to come to this, which is the first meeting that we're holding like this, but we plan to do this kind of a meeting every year, have it be an annual event going forward. My name is Mike Dowling. I'm the president and the CEO of Northwell Health. And as I just mentioned, it's a pleasure to be here in the company of some extraordinary individuals. Because if you look around the room, we have some of the leaders of the major stakeholders in healthcare. All the various parts of healthcare in some way or another are represented in the room here. And that's what in many ways is so important. So you might want to ask, what's the purpose of a meeting like this? Well, there's a number of things. One is to get to know each other. We're all in the healthcare arena. We're all looking at it from different perspectives. Many of us know each other, but we don't all know each other. And wonderful things happen when people get together and get to know one another. You begin to learn. You begin to think about things you didn't think about before. And you begin to become curious about what other things you should be doing. The second thing is, a meeting like this is to share innovations, things that are happening in the field that are pretty extraordinary. You will hear about some of those here today. It's an opportunity to observe. And in many ways, it's an opportunity to fuel curiosity. Many of you may know about other people in the room, wondering what are they actually doing? What are they up to? What are they thinking about? So it fuels the curiosity. It's also important in a meeting like this for something to elevate the importance of collaboration. Because if healthcare is to be reformed, and the reform debate and the word reform gets old. But if we are to really make the changes that we all know we need to make, we can only do it in an effective way if we collaborate, if we work together. I'm assuming that as a result of meeting here today, that you will leave having an idea about who you might want to collaborate that you didn't think about wanting to collaborate before. And it's also another major goal is to foster strategic partnerships, doing things together, learning from one another, cross-fertilizing ideas. We all know that everybody is talking about healthcare reform. It becomes a little bit old, but quite frankly, in my view, that if the combination of people in this room don't figure out how to do things together, collaborate and partner, and actually become advocates for reform in the right way, it's going to be done to us. Somebody will make some major change happen that may not be the changes that would be good for the end product. So when you leave here today, I would hope that you walk out of here with some ideas you didn't have when you came in, some learnings and some knowledge that you were not clear about as you walked in this morning, some new acquaintances and friends that you've made, and some new ways that you've decided that when I leave here and next week I'm going to call people up and say, how is it that we can partner a little bit more? So in many ways this is small. We wanted to keep the meeting relatively small. We wanted it to be informative, but also informal, because it's the interchange that's important. For too long in healthcare, we tend to stay in our own little silos. Obviously, Northwell, we're in the provider side. We're also in other parts of the healthcare arena. But we need to learn from others. you need to learn from us. And if we do that the right way, for the right reasons, then at the end, we will all be better off. And so will the people who benefit from the services that we are required to provide. So let me just say one word, and I'm not going to advertise this too much, but Northwell, many of you know who we are. Some of you may not know as much about us. But just a couple of words. We are the largest provider of healthcare in New York State. We have a very, very large distribution network in the region. We're also the largest private employer in New York State. We have all components of the delivery system, everything from primary care all the way to end of life. We're highly integrated. Common metrics, common standards, common protocols. And what's important is we're not just a hospital-based system. We have 670 ambulatory locations. Our revenue is now almost 50-50 split between outpatient and inpatient. A big shift over the years, because everybody talks about the hospital side of the world, which of course is very, very, very important. But innovative health systems are not just only in the hospital space anymore, and that's important for people who are not on the provider side of the world. We have a major academic teaching component. We're one of the largest academic teaching places in the United States, about 1,700 fellows and residents and fellows. We have a very innovative medical school, which is getting a lot of international attention and national attention. We have a nursing school, a PA school, a PhD school, an in-house corporate university. We use simulation in a big, big way for training purposes here. We have major research, Feinstein Institute for Medical Research, and you will hear from Kevin Tracy later on about some of the very unique things that are going on in that field, in the field of bioelectronic medicine. We're very, very involved in the community, and we have obviously relatively new for us in its current format is that we have a major for-profit part of the organization that invests in other companies, partners with other companies, consults with other companies. We grow our own businesses. We innovate internally with ideas from our own employees. So while we're large, and we have grown substantially over the years, size is not what it's all about. What it's all about is trying to be innovative, transformative, creative, challenge the status quo, be willing to be open for partnerships with people from all different aspects of the healthcare field. That's what's really important. And I have one or two other points I just want to make before I turn it over to the first speaker. And there's a lot of negativity about healthcare these days. If you listen to political debate, policy debate, talking heads on television, we have this love affair with negativity. Everything is bad. Healthcare is not working. Things are not happening the way they should happen. There's a pessimistic view, a dark view about healthcare. I take the opposite approach. I think lots of great things are happening in healthcare, as I think everybody in this room would recognize. Lots of great things, lots of great success. When you're on the provider side like we are, when you're face to face each and every day with the patient, you get to see the great things that happen. You see people being saved. You see families being put back together. You see miracles happening. You see the progress over the last 30 years in the advances in technology and science. You see things that we can do today that were not even imaginable 40 years ago, 30 years ago. You'll hear about some of that today. So there's a good story here. And it's very, very important, while we recognize that there are lots of things that need to be improved. There are many, many gaps. There are many things we don't do well. But it has to be put in the context of the great progress we've made and the great things that are currently happening. If you look at things through a negative lens all the time, you see it one way only. If you look at it through a more balanced, positive lens, you see things a little differently. We can build on the foundation of success to build greater success. There is a lot to be proud of. So when we're out there talking in the various arenas that we have the opportunity to talk to, we should be talking about the good things in healthcare while acknowledging that which needs to be improved. But not only look at it and begin to argue against those who only look at it through a negative lens. And one last point. While everybody talks about reform and about the changes that we can make, let's keep one thing right in front of us. None of it matters if it doesn't help the patient, the customer, and the family. That individual who today in our hospitals and our facilities all over the place are getting treatment for issues that we are very, very fortunate here in this room and not to have today. But someday we may very well. If it doesn't help the patient, and it doesn't help the customer and the customer's family, then we have to ask ourselves the question, why? So as we debate and discuss all of the great things we all do, individually and collectively, let's keep the person who eventually can benefit right in front. If it does a lot of things and it doesn't help make care better for an individual or a family, you got to ask yourself the question, why are we wasting our time? This is just not about growth.